Namaskar. Once again, welcome you all in Curega Samvaad Dil Se Dil Tak. Today with us, very eminent personality from field of obesity and bariatric. He is world-renowned bariatric surgeon, recognized globally by American Diabetes Association, and it's my great honor and privilege to introduce Dr. Shashank Shah to all of you. Today Dr. Shashank Shah is going to enlighten us on two very important things. And sir, once again, welcome you in Curega Samvaad Dil Se Dil Tak. Sir, we would like to request you to please enlighten us on two very important topics. One is when any obese patient should consult to doctor like you or intervene so that they can avoid any complication because of obesity.
Good afternoon everyone, and a very happy and healthy new year to all of you. First of all, let me start by thanking Mr. Chiranjeevi for an excellent social initiative. This is going to give a lot of health related information to everyone who listens to it, and it is the need of the time, so I congratulate him for this initiative. I am a bariatric surgeon. I am an obesity specialist. Obesity is now known as a disease, and everyone tries to struggle to lose weight and try and find out different types of ways to lose weight. There are many ways to lose weight, but it's very difficult to maintain. People don't understand why they gain weight. There are many thin people who eat everything, don't struggle, but still maintain a normal weight. So they are blessed with a healthy metabolism. Once the metabolism gets diseased, you start getting a disease of obesity, and it is a genetic disorder, complex metabolic and hormonal disease which gets combined with your lifestyle and then aggravates the disease of obesity. Obesity is known as a mother of all diseases. It can give rise to heart disease, kidney disease, giving pressure on the joints can give rise to joint pains, knee joint pains, backache. It can have effect on sex hormones and can give rise to infertility in women, decreased sexual libido in women. Excess fat deposition around the airways can give rise to a disease called sleep apnea, which is known as snoring in common man's language, or excess fat deposition in the liver can be a fatty liver disease which can progress to more serious diseases. All this combined together is a disease of obesity, and the most important disease which obesity can induce is diabetes. Diabetes and obesity are like twin brothers, and it's known as diabetes, and it is a disastrous complication for health. When should someone reach a bariatric surgeon? There are standard guidelines worldwide. In the last 20 years of practice, if I have seen maybe more than 100,000 patients, we have offered surgical treatment to only 8 to 10,000 them, and rest were treated medically. When can medical treatment work effectively? If you start early, if you start in time, and if you maintain for a longer time. Anyone with a body mass index between 23 to 28 or around 5 to 10 kg of excess weight can definitely succeed in losing weight medically and maintain it for a longer time with pharmacotherapy or with lifestyle change. But once the BMI starts going beyond 30, maybe beyond 32.5, why I am saying this is as the BMI progresses, irreversible changes start happening in body's physiology, body's hormones, and then body starts defending your excess weight. And whenever someone tries to lose weight, body's hunger hormone level will increase and try to regain the weight back. If the body mass index goes beyond 32.5, which is defined as morbid or severe obesity according to the Asian guideline, according to WHO, then these are the patients where medical treatment rarely succeeds in long-term weight loss. And hence, those with a BMI of morbid obesity, it could be even beyond 35 BMI, with uncontrolled diabetes, with severe sleep apnea, sleep disorder, excess pain, breathlessness on walking, maybe loss of self-confidence because of their appearance, and with associated diseases like metabolic syndrome, hypertension, high cholesterol, heart disease, kidney disease. These are the ones who can select an option of scientific option of long-term weight loss management and correction of their abnormal metabolism. It is known as laparoscopic metabolic and bariatric surgery. Fortunately, all the obesity related disorders can be totally reversed after surgery. Metabolic and bariatric surgery is now almost a daycare keyhole painless procedure. Patient can resume work in a day, and fortunately, the correction of metabolism through various hormonal changes eventually will result in normal restoration of metabolism. The surgeries have been approved by all diabetes organization, all obesity organization, and all physicians organization for all those with high BMI and uncontrolled type 2 diabetes. I believe that in this century, this has been a blessing for those with obesity and uncontrolled type 2 diabetes.
Thank you very much, sir, for very brief discussion about how obesity can be now managed and what are the complications which may be avoided if someone can intervene early. Doctor, now because you are expert from field of obesity and bariatric, I'd like to know if you would like to give a message to the society that whatever you have discussed now, how it can be prevented.
Very right message. I believe that prevention is better than cure. You should avoid rather than treating it. And the COVID pandemic definitely has taught us that a healthy lifestyle, not having obesity and diabetes, can have a better immunity in your life. A simple message for all those is eat healthy, be active, act on time if your weight starts gaining. The simplest way to know that the weight gain has started is looking at your waistline. If your waistline starts increasing, that is the time when you start acting, and then one can definitely prevent obesity if you start very early in time. Everyone wants to enjoy, everyone wants to eat, but the enjoyment shouldn't be daily. Junk food, parties, everything should be controlled in moderation so that it does not add too much of excess calories to your body. I always say that average caloric intake over a week, over 2 weeks, over a month could be totally controlled. So if you party once, then you have to compensate at least 3 times. Lead an active life, follow scientific guidelines for management. If you start gaining weight, use medications in time if needed, and lead a healthy and happy life forever. Once again, I would like to wish you a happy 2022 and a healthy 2022 by following these suggestions.
Thank you very much, sir, for your very insight, discussion on very important topic, and hope if someone will follow whatever you have discussed in this video, definitely we can live a long life and healthy life. And hope, sir, once again we'll invite you for some other topic which may help our society to prevent multiple diseases as well as complications. Thank you very much, sir. Thank you.